it's Jamie from the MTDC, and today with this blog post we were talking about how to handle somebody fainting in your clinic. So my friend Michelle is going to help me out, and we're going to pretend that in our clinic she's fainted. So basically what you want to do is make sure that you go through and check the person's ABCs, and then you're going to do a head-to-toe check to see if they've got medical alert bracelets, things like that, and to check and make sure that they're not injured anywhere else. And part of the reason for doing that is also to try to see if you can find out the reason that the person fainted. So if you were to go and they had a medical alert necklace or a medical alert bracelet that says maybe they're diabetic or have some other condition that could have caused them to pass out, that's part of the reason that you're going to do it. So all you're going to do is go down and do your look, listen, and feel just to make sure that they're breathing. So that's going to cover checking the airway. To make sure they're breathing, you're going to check their circulation, do your head-to-toe check. And then we want to get them over into the recovery position so that you're maintaining the airway for them so that their tongue isn't falling back on their throat. And if they were to throw up or something like that, you've got natural drainage that happens to keep the airway clear. So we'll just take it from the top. We'll just pretend that I walked in and Michelle was laying on the floor in my clinic. So just going to check and see if she's there. Michelle, are you okay? Going to do your look, listen, and feel for 10 seconds. Unfortunately, Michelle's breathing. Going to check circulation. She's nice and flush, has good color, which means she's got good circulation. So then we're just going to go down and check to make sure that she's not injured anywhere else. You're going to check her because she's unconscious. You're going to keep checking back to see if she winces when you hit any point on her body. So there's no injuries down there. You come up, check the arms, check for a bracelet. Checking to make sure she doesn't wince. No bracelet there. Okay, so now to get her over in the recovery position, we just take this hand, put it up here. Take this hand and put it beside her face to support it. Bring one knee up, and the more angle you get in the knee, the more leverage you've got to be able to roll her over. So now supporting her head, and with 2 fingers, I can just roll her right over and get her into that recovery position. So now her airway is maintained and she can continue to breathe. So if we just bring her back, one issue you could run into is if you're in a tight space in your clinic and say they're up against the table, you may have to roll them the other way. So in that case, you just put this arm up, this one here, you go to the opposite leg, and then still supporting her head, you can get her rolled right over and her airway is still maintained. Perfect, so hopefully that helps you if you ever have somebody faint in your clinic.